So you mentioned a little bit about following, ferritin, procalcitonin, and that potentially deciding who gets the IL-6 antagonist. Can you talk a little bit more about how you use these kind of inflammatory markers?
Yeah, so like, because they're so persistently febrile, you're always wondering, is there an underlying bacterial infection? And so they do get cultured, but we don't necessarily treat them with empiric antibiotics because most of them have been febrile and is not from bacterial infection. And so we've just kind of followed these markers. So we have an ID consult on pretty much everyone who's COVID positive, and they're kind of helping us make the determination around using IL-6 inhibitors or putting them in a trial for these different medications. So we are using like the protease inhibitors for that have been used for like HIV. We're in trials involved in using those for certain patients. And so ID is aware of the protocols in terms of like who would meet criteria to be in one of these trials. And so we've tried to have them involved in that conversation from the beginning. And so, but they all get CKs, troponins, CRP, ferritin, D-dimer, procalcitonin, like almost daily. They're getting all of these labs checked and followed. Mostly because you don't necessarily have the ability to get imaging tests that frequently to like follow it otherwise.